In the first part of this clip, the person performing the ultrasound is evaluating the popliteal vein. The popliteal vein is right here, and you can see even before you try to compress on the vein that there's echogenic material in the lumen, which is a clot. When you put compression above the vein, you should see the walls of the vein touch. In this case, the walls of the vein aren't touching because the clot is preventing it. There's compression and it's not touching. Next, the ultrasound performed a color evaluation. So they put color flow on the vein, and you can see on the outside of the lumen where the clot is that there's no flow through that region. Well, it's okay to put color flow on. The standard is really to evaluate the vein with compression. If the vein doesn't compress, you should be concerned about clot, and if the vein compresses and the walls are able to touch each other, then that rules out a clot in that portion of the vein. Next, we're going to look at some images of the heart, and you can see evidence in these images of right heart strain. So you've got a parasternal long view here. The most anterior chamber of the heart is going to be your right ventricle. Down here you've got your left atrium flowing into the left ventricle, and then this is your aortic outflow tract. So aortic outflow tract, left atrium, right ventricle, and then down here left ventricle. So the left atrium, aortic outflow, and right ventricle in a parasternal long axis should be roughly 1 to 1 to 1. You can see here that the right ventricle is clearly enlarged, which is concerning of right heart strain, such as you might expect to see in a pulmonary embolism. Next, we're looking at a parasternal short image. And what you can see in a parasternal short is a cross-section of the two ventricles. So you've got your left ventricle here, and then you've got your right ventricle here. Usually what you expect to see is what looks like a donut with a croissant on the side. So the left ventricle looks nice and round, and the right ventricle, which is more of a conical shape, appears in the shape of a crescent. What we're looking at in this clip is evidence of septal flattening, or a D sign. So because of the right heart strain, there's a lot of pressure in the right ventricle. This is the interventricular septum. So when there's a lot of pressure in the right ventricle, it's going to push this interventricular septum over and flatten it out during diastole. So when it should be filling, you should expect it to be nice and round. Instead, this septum flattens out and you get what looks like a D sign because this is straight up and down and that's rounded. So that's interventricular septal flattening. This is called a D sign. You can see the septums being pushed over.